Thank you, Mr. Chairman. This is a very important hearing, but I'd like to start by talking about the very concept that we're here to discuss, because the term post-claims underwriting is an oxymoron. Insurance companies are structured into different departments. They have an underwriting department and a claims department. And the underwriting department is supposed to do pre-issuance risk assessment to determine whether an individual policy is worth the company investing in that person as a healthcare risk. The claims department is designed to respond to requests for coverage after a policy has been issued. So the very theory we're here to talk about today isn't even supposed to exist in a rational healthcare delivery system. And it wouldn't exist if we had a rational healthcare delivery system. But when you read news stories where the CEO of one private health insurance company is sitting on stock options valued at $1.6 billion, it shouldn't come as a shock to any of us that we're sitting here today hearing these horror stories of patients who've been caught up in an inefficient, unsustainable private health insurance delivery system. And Ms. Raditz, I wish that every claims examiner at every insurance company and every underwriter who gets engaged in post-claims underwriting determinations had to go through what you went through and the other witnesses who are here today. Because one of the most profound experiences I've had in my life was spending about a month at a pediatric oncology unit at the University of Iowa Hospitals and Clinics when I was in the Big Brothers Big Sisters program and my little brother was diagnosed with acute large cell non-Hodgkin's lymphoma, and spend time every day watching young patients with no hair, with IVs in their arms or in their chest going into a port, walking around and taking care of each other much better than our healthcare industry takes care of patients in their time of need. And it's a slander on the names of the healthcare professionals who do everything they can to keep patients like your brother, like my little brother, alive when we don't give them the support that they need after they have invested their hard-earned dollars by paying premiums to a healthcare insurance company who turns their back on the patient in their hour of need. And that's why I'm a strong supporter of the public health insurance option, and I'm proud that my colleagues on this committee, Chris Murphy and Peter Welch, have joined me in introducing the Choices Bill to give health insurance patients a public health insurance option with no discrimination so we don't have to go through these nightmares anymore. And with that, I yield back.